Meeting. Welcome and solidarity on this International Women's Day. My name is Frank McIntaggart. Most people know me, I think. Chair of Defender NHS, also part of the Issues the Nhs Kill the Health Bill campaign. Right, we've got two speakers tonight. The first speaker is Margaret Greenwood MP, who I think most or all people will know. Margaret is a founder member of Defend Our NHS, and she's been fighting the bill in the House of Commons over these last months. So Margaret is going to give a report on the state of play, etc. in Parliament. There'll be she's going to speak for about 20 minutes. Then there'll be 15 minutes of questions, and then we'll have our second speaker who's going to talk about women's health and so on. Okay, so over to you then, Margaret. Cheers.
Thank you very much, Frank, and it's fantastic to join you on International Women's Day. I'm really delighted to be here. So my only disappointment is I can't see everybody who's here, so I can see their names, but I can't see their faces. That's a bit disappointing. So yeah, I want to talk about the Health and Care Bill. Firstly, I want to begin by thanking absolutely everybody who's campaigning against it. I know that people are campaigning really hard, and everything that you do is massively important because it's about putting pressure on the government and raising awareness of what this bill will mean. We all know that it's a privatising bill and that it's vital that we do whatever we can to stop it. And we know that it's going to tear our National Health Service up and leave us with a fragmented service in its place, which will be much harder for us to scrutinise, amongst other things. Now, we don't have a final version of the bill yet, because it's still making its way through Parliament, but we already know that there's an awful lot wrong with it. So I'm just going to talk about some of the issues. Now I'm going to talk a bit about some of the amendments that I put down, some of the amendments that have gone down in the Lords, and where things are up to. So some of the key issues. The NHS would be broken up into 42 integrated care boards, which would have responsibility for commissioning services. So for us, we would be part of the ICB for Cheshire and Merseyside. The government plans, I believe, will lead to a postcode lottery because each ICB will develop a different plan for its area, and there will be strict financial limits, I think, will lead to increased local rationing of care. The bill provides for the deregulation of NHS professions, and this has the potential to impact on the status and over time the level of expertise of the people who work in the NHS, which we all value so highly. And I also think that it would then lead to a downward spiral in the pay and pensions of the workforce and a reduction in the quality of the services that we as patients can access. The bill will also remove the procurement of health services from the scope of the Public Contracts Regulations 2015. So we will see a regulated market become an unregulated market, with contracts handed out without these kind of stringent arrangements that we would want to see in the awarding of public money. Now, originally, the government was ready to let big business sit on the integrated care boards, decision-making boards, and provide services, which would have embedded conflicts of interest in the system and opened the door to widespread cronyism. I think campaigners, including lots of people who were on this call, did an absolutely fantastic job in terms of putting pressure on the government on this point. And the government has come forward with an amendment about this, which I will come to shortly. The bill also makes provision for the revoking of the national tariff and the creation of an NHS payment scheme, which I believe has very serious implications for staff pay terms and conditions. So private providers will be consulted on the NHS payment scheme, and I have a real concern that it will, in effect, give those private healthcare companies the opportunity to undercut NHS providers, and that we'll see healthcare that should be provided by the NHS increasingly being delivered by the private sector. And if that happens, NHS staff may find themselves forced out of jobs that are currently on agenda for change rates of pay, NHS pensions and so forth, with only private sector jobs with potentially lesser pay and conditions available for them to apply for if they wish to continue working in the health service. So those are some of the, I mean, there are so many things wrong with this bill, but those are some of the really, really important ones. Yes, there's one I've missed out, but I'll come on to it later on, actually. So I'll just talk about some of the amendments that I put down in the Commons. So I put down an amendment which was designed to prevent big business from sitting on ICBs. and Labour's front bench also put down an amendment on this. So the government, you know, and of course campaigners have been putting pressure on the government on this. So the government did bring forward its own amendment in the Commons to address this at report stage, which was designed, as they said, to, and I quote, protect the independence of ICBs by preventing individuals with significant interests in private healthcare from sitting on them. So this amendment, this government amendment, actually simply, quote, prevents the appointment of a member of an ICB if they could reasonably be regarded as undermining the independence of the NHS because their involvement in the private healthcare sector or otherwise. I feel that this amendment from the government is weak, particularly given that ICBs will be able to delegate functions and devolve budgets to a complex array of subcommittees, such as provider collaboratives and place-based partnerships, which could include private companies. And I've pressed the Minister on this on a number of occasions and will continue to do so. So I tabled an amendment to try and combat this, to ensure that an organisation carrying out the functions of an ICB on its behalf is a statutory NHS body. So this was designed to try and stop ICBs from being able to be entities like provider collaboratives and place-based partnerships, which of course may well and will include the private sector. I also put down other amendments, including one to ensure that integrated care partnerships are made up wholly of representatives from public sector organisations, and that private companies are not represented on them. An amendment to ensure that a profession currently regulated cannot be removed from statutory regulation and that regulatory bodies cannot be abolished. One to ensure that social care assessments take place prior to discharge from hospital. So this was one of the things in the bill that I thought was particularly shocking, and it's this procedure known as discharge to assess. And the idea was that, you know, people would be discharged from hospital before their needs had been assessed. And so I put down an amendment opposing that. I also put down an amendment to ensure that the pay rates for agenda for change, pensions and other terms and conditions of all eligible NHS staff are not undermined as a result of the adoption of the NHS payment scheme, which I referenced earlier. And this amendment was supported by the Royal College of Nursing, who asked MPs to get behind it. I was pleased about that, but unfortunately we didn't manage to secure it. And another one to ensure that all relevant trade unions and other organisations representing staff who work in the health and care sectors are consulted by NHS England on the likely impact of the proposed NHS payment scheme. This was also supported by the Royal College of Nursing. I'm very grateful for their support. And then another amendment to ensure that any providers of health services cannot withhold provision of those services from any individual because of the integrated care board that they have been allocated to. And this is designed to combat people being turned away from A&E because they present at one which isn't closest to where they live. Sorry about that. That's one of the things that happens when you do this from the House of Commons. Okay. So unfortunately, none of my amendments were selected for a vote by the Speaker of the House of Commons, despite them securing cross-party support. So I then worked with a number of members of the House of Lords, and I'm particularly grateful to Lord Davies and Lord Hendy, and numerous others actually, including Baroness Chakrabarti, who spoke out on the bill. Lord Davies and Lord Hendy tabled, sometimes they tabled the exact same amendment that I tabled. In another case, it would be a similar one in the Lords Committee stage. So first and second readings of the bill in the Lords took place before Christmas, and committee stage in the Lords took place over January and February of this year. There aren't any votes in the Lords during committee stage, but there was lots of detailed discussion about the bill. And I think that the work of campaigners can be seen in the depth of discussion that's gone on. Yes, so the amendment to do with ensuring that providers can't withhold provision of health service from any individual because of the integrated care board that they've been allocated to, Lord Davies put down in the Lords, and it's to stop people being turned away from A&E where they live. Now, I'm sure lots of people on this call will know where this has come from. So the issue arose from a Manchester Evening News article last September, which I believe Defend Our NHS shared on the Facebook page, which told of a woman who suffered burns while on holiday in Northumberland and chose to return to an urgent care centre closer to her home in Rochdale. There was a long wait there, so she was advised to go to a local A&E, but once she arrived, she was told that the hospital didn't treat people from Rochdale due to protocol. So she had to go back to where she was in the first place. And this was all happening while she was in urgent need of treatment with very severe burns. Now, in response to Lord Davies' amendment on this, the minister said the government was concerned about this particular amendment, and he said, as it places a requirement on providers rather than commissioners. He went on, it would not be reasonable to expect providers to provide services regardless of whether they were funded by an ICB to do so. And it is important that ICBs should be able to make decisions about with whom they contract and where they prioritise their resources. So this is a matter of real concern, and I think it's something that we need to focus on campaigning on as we go forward. And he also said, however, it is important to remember that no one will be denied healthcare on the basis of where they live. Now, I think it could be argued that these two statements would appear to be contradictory. So I do remain extremely concerned that without it being made explicit that people will be able to get treatment at any A&E or any urgent treatment centre, people may indeed find that they're denied emergency or urgent treatment.
From Leslie saying she'd alert Mary about it. But
I'm getting some feedback, sorry. They may find that they're denied the emergency or urgent treatment that they need if they're seeking such treatment away from where they live. It's a really important point. So I think it's something that we need to pursue the government on. So it's important to say that we're still at report stage in the Lords, but the time is running out. So the current date for putting ICSs on a statutory footing is the 1st of July 2022. I just want to sort of finish by saying there have been some successes in the Lords. So Baroness Keithley, who's a Labour peer, her Amendment 113 was agreed to, and this retains the principle and duty on a hospital, whether it be an NHS hospital or an independent hospital, to ensure that a patient must be safe to discharge from hospital, and mirrors carers' rights that were established in the Community Care Delayed Discharges, etc. Act 2003. I think that this was an important amendment that was secured and one that we should campaign on. Baroness Cumberledge's, whose Conservative cross-party Amendment 80, which Labour frontbenchers support, was agreed to. This requires the government to publish independently verified assessments every 2 years of current and future workforce numbers required to deliver care to the population in England, taking account of the economic projections made by the Office for Budget Responsibility, projected demographic changes, and the prevalence of different health conditions and the likely impact of technology. I think it's a very important amendment. And interestingly, it's a requirement for the government to publish independently verified assessments. So I think that's very useful. Labour's frontbench Amendment 84 was agreed to, which leaves out Clause 40, reconfiguration of services intervention powers from the bill. Labour's frontbench Amendment 9 was agreed to, which is intended to ensure conflict of interest rules that apply to an ICB also apply to commissioning subcommittees, such as provider collaboratives and place-based committees. Labour's frontbench Amendment 141 was agreed to, which removes Clause 155, which is on cap on care costs for charging purposes from the bill. Now, I totally expect the government to remove these amendments from the bill when it comes back to the Commons. But obviously, MPs will have the opportunity to speak on Lord's amendments, which is what happens when a bill comes back. So I think it's important that as a campaigning community, we all have a good look at these amendments and work out how we're going to communicate with MPs and tell them about the amendments that we really want them to fight for. And as I said, the report stage in the Lords is ongoing. So we have to look out to see if there's any more changes going to come through. Once they finish report stage, they'll have third reading, and at that point, it'll be sent back to the Commons for consideration of Lords' amendments. Now, it's important to understand that the timetabling of business is very much a matter for government. Obviously, I'm sure everyone here is, and I will continue to keep a close eye on the bill's progress in the Lords. It might come back to the Commons before Easter, depending on how the progress in the Lords go. or it might be that it isn't back in the Commons until after Easter. But I think, you know, we've only got a very short amount of time really to continue to campaign on this bill. And as we run up to the local elections, I actually think it's a very good time to campaign, because I know that, you know, really making sure that MPs are held to account around what they do is massively important. So I think that, you know, the next step, my view on that, what I'll be looking to do is to really look at these amendments and come to some sort of a picture as to the things to ask people to press their MPs on to support. So we can make sure that, you know, we give as good a fight as we possibly can. And I'm going to close my comments there. Thanks very much, Frank.
Thanks for that, Margaret. Thanks very much. That was very detailed indeed. Okay, so I'll throw up the questions now for about 15 minutes. If people can put their hands up using the electronic device, because I can't see everybody on the one screen, that would be great. And Teresa, you're the first one to put your hand up. Teresa, and then Felicity.
Can you hear me?
Yeah.
Hi, sorry. I've got the leggy off my grandbaby, so I've got like a tonsil, like a football. Thanks for that, Margaret. You mentioned a few of the lords. Where does Baroness Tanni Grey-Thompson stand on this? And for people who don't know, she's disabled, she's a wheelchair user, and she's an ex-Paralympian who represented this country, and I followed her through the 90s, 2000s, exceptional. As a disabled person, it doesn't matter where you sit economically, you're always going to be the most vulnerable, because disabled people require more help and treatment than people who are not disabled. Where does she sit on this?
Okay, that's a fantastic question. I don't know her, and I don't know where she sits on it. So I think what would be good would be to go back and have a look at Hansard to see if she's spoken on it. If she hasn't spoken on it, I think it'd be very worthwhile to write to her and really set out, you know, why she should be opposing it. I think that'd be really worthwhile, because, as you say, you know, people who are disabled are going to be hit by this harder than anybody, actually, in lots of instances.
Yeah, and can I just also mention, because you said discharge to assess.
Yeah.
To me, that's definitely social murder, because while there may be a few people who have somebody, family or whoever, to support them whilst they're waiting, you don't judge it on that, you judge it on the most vulnerable. So I know a few years ago, the Tories wanted to bring in a thing where if people were bed blocking, and there aren't any bed blockers, people don't want to stay in hospital, they want to go home, but those people who were referred to with that toxic narrative as bed blockers needed to be assessed and needed help. They couldn't go home independently. And the Tories were talking about telling family members to get them out within a 3-week period, or they were going to sue them and take them to court for bed blocking. What a toxic, bloody narrative. So when these things are being spoken on, do people talk about the most vulnerable? Because I think if it's a generalized thing, people say, oh, people have got family members, they've got someone to look after them, their next door neighbours can pop in. It's the most vulnerable, and that's how you assess everything. So do they try to get away with that by saying, oh, a lot of people have got friends? Because we're aware that Hancock was saying that family members should look after their family members. So they wouldn't be able to go to work. They wouldn't be able to look after their grandchildren because they're being asked to be the carers. And it's not that family members don't want to care. It's that in certain situations, they just can't because they have other issues going on. They may be sick themselves and what have you. So I do worry when toxic narratives are allowed to flourish and they're not being challenged properly. But thank you anyway.
If I could just comment on that point, Teresa, I think you're absolutely right about the toxic narratives. And I think that what's important here, and I think I was really pleased to see this amendment of Baroness Pitt Keithley. it retains the principle and duty on a hospital, whether it be an NHS hospital or an independent hospital, to ensure a patient must be safe to discharge from hospital and mirrors carers' rights we're establishing in the Community Care Act. I think it's incredibly good that she secured that, and I would encourage anybody to write to the newspapers about this or do radio phonings, because I think that you're quite right. The Tories have tried to put forward this narrative that somehow families should look after people, you know, and it's utterly unrealistic. If you've got someone with dementia, depending on the state of their dementia, you know, they may become violent. They may, you know, the loveliest person in the world can become violent when they acquire dementia, or is up in the middle of the night walking the streets, or, you know, other things. And you need a lot of care for somebody in that situation. Similarly, somebody with mobility issues. If you discharge someone from hospital too soon, you know, someone can do a lot of damage to themselves purely by being sent home too early. And I think that there is a weakness in the government position around this. And I think that this is one that we should definitely all be pushing on. We should be writing to the papers about it and phoning in the phonings for it. To really, you know, because I think the general public understand this one. I mean, one of the issues with this bill is, because it's a thing of complexity, because that's how they're doing it, to try and throw everyone off the scent as to what they're doing, obviously. But this is something that I think that families do understand, and they'd say, what? No, don't discharge people when they're not ready. And the elephant in the room, of course, is that if you had a social care system that met the needs of the population, they wouldn't even be having this conversation, would they? Because it'd be just like, oh, right, yes, we've got the care system here. This patient is ready to move into whatever setting that they need, or to be at home with the support that they need. And then that would happen. But we all know, I think there's something like, don't quote me on the figure, but I think there's something like 400,000 people on waiting lists for care in local authorities. I mean, that's nearly 500,000 people, you know. So these are people who desperately need help, who aren't getting it. So we know that the care service is in crisis. And if that weren't the case, I don't think they'd be bothering with discharge to assess. It's just a way, and really, it's an outrageous thing, really, isn't it? Because, like you say, some of these are some of the most vulnerable people in the country. They're frail, they're recovering from illness, and some of them have got illnesses that they are never going to recover from, actually. Yeah. Thank you.
Thanks, Margaret. Felicity.
Sorry, I think we need two thank yous to Margaret, one for coming today, but the second one for all the really detailed work you've done on this. And you know, I think they did think they could bamboozle everybody, but they reckoned without you and a few other MPs. So thank you very much for that. I want to think about this in terms of our campaigning response.
Yeah.
Now I think we've done about 10,000 leaflets in the last month.
Wow.
And we've had the big ad van going round. So, and lots of stalls, lots of events. So yeah, we've done an awful lot, but we need to have a really paced, and I don't mean to scale it down, but a paced response to the next period. We need to know when the crunch points will be, when the MPs might be worried, when we're likely to get most publicity, and you know, when the strategically correct things to go will be. You said you thought it might come back before Easter, come back to the Commons before Easter. So for the next couple of days, we can still be contacting members of the House of Lords.
Yeah.
Okay. And then you mentioned, then it will suit us if it doesn't come back before Easter. And then there's the local elections. And making it a big issue in the local elections is going to be important. Are there any other dates? There's two questions really. What other dates might we need to have in mind? And a request really of, could we have the speech you've just made as a text, if you've got it as already typed up? Because then we can cross-check things when we're writing leaflets and make sure we get the right number of the or writing to MPs, we get the right number of the amendment that we're talking about. So thank you very much, and but we're all set to do a lot more, but let's make sure we do it at strategic times.
That's great. Thanks so much, Felicity. Thanks for your kind remarks, and thank you for everything you're doing. I mean, I think it's phenomenal. 10,000 leaflets is amazing. And in terms of, you can have the text of my speech, what I would quite be very happy to do, if you're working on a leaflet, if you want to share it with me so I can sense check it as well, I'd be very happy to do that if that was something that you'd want to do. The other thing that I haven't had the chance to do it yet, but I am going to be doing it, I'm going to be thinking about kind of strategically what I think we should be pushing on, if you like, so that I can try and put some stuff out there myself. It's incredibly difficult to get in the media and stuff, but because if there are certain amendments, when we get to the end of report stage, I think what I'd like to do is have a look at the amendments and say, right, these are the ones that I would write to an MP to say, you know, you need to support this. So I'd be very happy to share that with you when I've done that work, if that would be of any interest. And in terms of dates, I mean, I think once it's been through the Lords, sort of kind of regrouping and getting the next campaign narrative together is kind of the next step, isn't it? And then at that point, to start hammering the Tories as soon as possible, really, because there's lots of different ways that it can be done. You know, social media as well as leaflets and street stalls. I know everybody's doing a huge amount of work. And thinking about where there are Tory MPs to lobby, and if anybody, you know, lives in an area with a Tory MP, because that's great. You can then ask for a surgery with the MP if you're a resident. You know, so going with the arguments there and ask them what they're going to do about these amendments. And as you say, continuing to hit the Tories over what it is that they're doing. So I think, I hope I've answered your question, but I think that we need that sort of regrouping once it's finished in the Lords to say, right, this is now the picture. This is what we're fighting. And also along with that, continuing to explain to people that this is about privatising the health service and what's going to happen. I think, and then down the, well, we won't talk about once the bills, whatever happens with it, but there'll be another job to do after that, won't there, to look at how we measure the impacts and what's happening and so forth, and how we scrutinise everything that's going on. But I think as soon as it's through the Lords, I think that would be the time to start back hitting the MPs with stuff.
Okay, yeah, thanks for that, Margaret. We have already done some of this. Mary and Ryan, a few other people have targeted some of the Tory MPs in Cheshire and Merseyside, and it's a good idea. It's something that I'm sure we'll be stepping up again, most definitely. Okay, Julia, and then Leslie. Okay.
I'm muted. Thank you so much. Firstly, I want to say thank you to Margaret. I think it's fantastic. Secondly, thank you to all of you, because I don't know any other major effort like this that's going on elsewhere, and I think it's great what you're doing. I might confess thirdly, Margaret, could you just adjust your screen, because I lip read and your mouth is right down at the bottom. No, it's okay, I've managed to catch up, but if you could just slightly. And my main question was going back to the equality theme. I haven't seen any evidence, and I confess my ignorance, of any equality impact assessment being done on the legislation. And is it challengeable under the Equality Act because of its disproportionate impact on people with disabilities, all shapes, you know, of all kinds?
That's such a good question.
Thank you.
Yeah. I don't think there has been. Sorry, can I answer this now, Frank? Sorry.
Yeah, sure, Margaret, yeah.
Yeah, sorry about not being visible, Julia. The thing is, I can't see myself on the screen, so I've no idea where my head is in your screen. So I do apologise for that, but you can have a copy of the text anyway. So I don't think an equality impact is, I'm saying that. I actually don't know. There probably is some small print somewhere that says that they have. I don't know. I'd have to look into that. I can ask the question. And then, of course, is it challengeable? Well, the problem is it's primary legislation. So if they pass primary legislation, then that's the law and that's what they can do. Having said that, I'm sure if there is a way to challenge it, people will. But I'll look into that and maybe feedback through Frank. Could I feedback through you?
Certainly, yeah, no problem. Yeah, that's great. Okay, thanks for that, Margaret, and thanks for the question, Julia. Leslie.
Okay, I hope I'm unmuted, and I hope Julia can see me, because I can only see the chair or the speaker. I've no idea where my head is at the minute. Again, I'd just like to thank Margaret for all the work she's done and keeping us up to date. My question is asking if there's further discussion happening with the unions, because some unions have very recently, very late in the day, started talking about the health and care bill, but mobilising members still seems to be quite limited. And as you say, that this bill will basically destroy pay and conditions within a few years. And we've had some good support from unions, but it is quite worrying when we've been doing the early morning leaflets and other stalls, etc. at hospitals. You know, a lot of the staff don't actually know what's going on. Never mind the public kind of get it quite quickly, but We Own It did that survey that shows that only 30% of people are aware of the health and care bill and some idea of what it means, and the rest don't. So we've got a huge job to do. And the last point is just, we've had some briefings with MPs, you know, including yourself. So I think maybe another one is probably due when it's time to look at the key amendments, when it's coming back to the Commons. And obviously, you know, you've taken part in those briefings, so it would be really good to have you back and invite the other MPs to do that. So thanks again.
Okay, can I just say very quickly what Leslie said there, if for anybody's benefit, because Leslie's video was off. But basically, she was talking about the trade union situation, and have you got that, Julia? Can you see me? Basically talking about the trade union situation and trying to get the unions involved more. And a couple of the unions, Unite particularly nationally, has got involved sort of recently. The GMB locally in this area has got involved in terms of financially, and the various trades councils, like Wirral, Liverpool, etc., have been very good as well. But beyond that, it has been very difficult, and it has been very difficult to get the point over actually in hospitals and so on. I don't know if there's anything you want to say about that, Margaret.
Thanks very much. So Unite the Union, I've had a lot of, Unite have been very helpful throughout this with me, actually. So I've had a lot of interaction with them. And so you may remember, well, I don't know if you're, some of you may be aware that myself and a number of MPs, so it was Barry Gardner, Rebecca Long-Bailey, Richard Bergen, and well, John McDonnell unfortunately had to leave before we did, but we delivered a gigantic bill to Boris Johnson for the care he received in hospital, you know, what it would have cost if we had it gone private. And Unite, you know, really helped us do that. So they've been doing a lot sort of behind the scenes and organising things and so on. So that's been fantastic. The RCN have been really good as well, although not so much publicly. But I think that's, you know, every union's got its own kind of way of working, hasn't it? So I've just been grateful for any help that we've had. But I think, it's, you know, I can't remember what Leslie's question was. I think you were talking about the fact that only 30% of people are aware of the bill. This is the thing that's so extraordinary to me, that we've got to this position where there's this bill that is basically completely undermining our National Health Service. And most people don't know about it, and it's not on the news, and it's very difficult to get it in the press. So anything that people can do to put it in the press is really worthwhile, but also anything that people can do to raise it within their own unions, to see if even at this late stage we can get unions involved. I mean, Leslie, I'm interested when you say some are getting involved late in the day. Is there anyone in particular you're thinking of?
Yeah, I mean, Unite has put out posters in Tory areas. I mean, Mary Whitby's probably more of an expert on this because she's a Unite member, and they did seem to be sending some stuff around. I mean, strange, you know, interestingly enough, like the Bakers Union have been putting out stuff in Hodson, but in terms of people who've got a membership amongst health workers, Unite has more recently seemed to have done a bit more, but the the unions as a whole, especially the ones with health members, don't necessarily seem to have really focused on trying to mobilise their members. That's a worry for me. Thanks.
Yeah, thanks, Leslie. And I think that actually that there's a thought with regards that regarding the amendment that Lord Hendy put forward around Agenda for Change, because he did, I put down this amendment to try and basically ensure Agenda for Pay change, isn't eroded, and that people's opportunity to receive Agenda for Change, in other words, that it's the NHS still delivering services rather than the private sector. And Lord Hendy did sort of really, because he's an expert in employment law, as I understand it. So he did a lot more on that. And I think from what you're saying, it might be an idea to try and distill his concerns and make contact with some of the other unions again. So I'll have a bit of a think about that. And if anyone's got any thoughts on that, it'd be really great to sort of communicate around it. So I'm just going to make a note of that, if that's okay.
Thanks, Margaret. Right, there's two more people who got their hands up. If we can very quickly have those two questions, and then we need to move on. Okay, Irene and then Thomas.
Hi, thanks, Margaret. I don't want to embarrass you, but I think what I'm going to say probably will make you feel uncomfortable. I think the unions are treacherous in terms of defending the NHS. They signed up to a social care policy, Mary knows the name, in 2006, which was to help the transition through away from the NHS. This was held in secret, and the minutes were there. The unions are paid by the members. They are nothing but a member representative. That was a complete treachery and betrayal of members' interests. And it was only when Yorkshire Byline Times published it very recently that the scale of the problem, I felt sick when I read it, the scale of the problem and the mountain we have to climb. Without and I don't believe, Margaret, and I'll never accept it, I don't care how many people sit around a table, how many big union men or women tell me I'm wrong. I don't believe that anything done behind the scenes about a public interest matter is acceptable. The reason we aren't getting the support we need, the reason we don't, is because we look like a bunch of individuals on the streets, because we haven't got the big unions behind us. And if I really rate Sharon Graham and think she's come out, she's done marvelous things, and without her we'd have even less token gestures to say we did our bit. I don't know what you can do about that, Margaret, but I would out every single union rep who was part of that group and who's failed to defend this most precious institution of the welfare state. And I really think we need to do something about that and not just let it go. I worked in the health service for over 30 years. I was in a number of unions as my professional body mutated, and none of them did anything. Now, the change was going there. I say to people, I went in as a valued member of a team, skilled and invested in, and I shared my skills and we worked together. We ended up devalued, undervalued, and unskilled. The unions did nothing. It's a personal experience that can't be talked away. So I really feel very strongly that the unions are a big part of the problem, and I think history will show that to be the case. And I would take that on as a banner platform. We need to win this. We can't mess around now by having polite conversations with people who've already shown their cards and they are privatizing the NHS. We need to change. We need to change. They don't need to change. They're getting exactly what they want. We need to change. Sorry, DM25 for me all the way.
Right. Okay, thanks, Eileen.
Sorry about that, but I feel so powerfully about it.
Okay.
Can I just ask a question? Sorry, just before you go on, Frank. Sorry to
Yeah, come on, Margaret.
Could I just, Irene, could I ask you, did you say it was the social care policy in 2006? Was that?
No, Mary, what was the name of the organisation, social policy organisation? And it was caught together by, not Margaret Hodges, the other, another Labour, senior Labour.
Leadership Forum, Irene.
Sorry?
And it's the Social Partnership Forum.
Yes,
Social Partnership Forum, yeah.
Yeah, I haven't got my notes.
It's written in the chat.
NHS England and the unions, and it's chaired by Unity. And as you say, it is currently all about facilitating the health and welfare bill being implemented.
And they've been doing that for 16 years. And I haven't got my notes for that in front of me, and I always forget unless I've got my notes.
Okay, we're starting with the timetable, starting to slip my face. Thomas, can you come in very, very quickly, and then we do need to move on, really. Okay. Thomas, hello, you there? No. No, okay. Thomas has got his hand up. But... Right, we'll have to move on anyway. His hand's down now. Okay, the next speaker is Rebecca Smythe, and Rebecca's a retired midwife lecturer, and she's a long-time campaigner for maternity services and women's health. And to mark International Women's Day, Rebecca's going to talk about overcoming the divide in healthcare. So over to you, Rebecca.
Thanks very much. Can it be really, I don't mean to be rude, but it's Smith, not Smythe.
Oh, okay, sorry.
It's with the Y, and it just throws everybody and people, anyway, so yeah. Hi everyone, and firstly, happy International Women's Day to you all. Each year, the International Women's Day organisation identifies a theme, and this year the campaign theme is Break the Bias. And I thought I'd just begin my talk with a quote from their website. Okay, so this is what they say. Imagine a gender equal world, a world free of bias, stereotypes and discrimination, a world that is diverse, equitable and inclusive, a world where difference is valued and celebrated. Together we can forge women's equality. Collectively we can all break the bias. And when they say break the bias, I know everyone does this. We could all do that. When I say break the bias, we'd all say break the bias. Okay. So I'll give you my my short talk now. Okay. So my talk is going to have a particular focus on bias, given it's this year's theme. And as we all know, our sex has significant impacts on our health. And I thought let's see if we can better recognize this bias and think of ways to break the bias. I think we'll all agree that roughly half of the world is inhabited by women and half by men. However, I think that is where the fairness of the divide ends. So the focus of my talk is going to be on inequalities there are in access to healthcare and healthcare outcomes for women, and wanting to identify some of the bias that is present. But before I do, I think we need to consider and acknowledge where the evidence comes from, where our knowledge and our understanding actually comes from. Because I think recognizing this goes in some way to breaking the bias. Or we could actually just call this unfairness, or perhaps even call it discrimination. So most of our knowledge about health, some would actually say pretty much everything that we know, uses data, and it's this data that is male biased. In other words, it favors men and does not reflect the true world that we live in. So our decision making, healthcare treatments, for example, are all based on data gathered from men, and this is known as the gender data gap. It's where one size fits all. And this approach has been used, and it's left gaps in our understanding of the experiences of women, because it's all basically male bias. In other words, women have been excluded. So the upshot of what we understand is completely skewed in favour of men. It's a male default world that we live in, and we need to break this bias. Now, I've got some examples that I thought I could share with you, and the first ones are a little bit light-hearted. I mean, this first one, although light-hearted, is nevertheless annoying. And I think all of us can relate to room temperature. You know, especially I think room temperature at home if you have males in the house. And there's ample evidence that office environments are tuned to the male biology. In fact, air conditioning is often set according to the 1960s formula based on the metabolism of a 40-year-old man who weighs 11 stone, whereas previous studies have suggested average woman is most comfortable at around 25 degrees Celsius, 3 Celsius degrees higher than for a man. Another light-hearted one I thought could just identify are mobile phones. So just like the piano keyboard, smartphones are designed for male hands, and they are affecting and can affect women's health adversely. It's a relatively new field of study, but there is research, and it doesn't look positive. Within the studies that women were significantly underrepresented, and the vast majority of studies don't break up the data by sex. Where they did, it has been reported statistical significant differences on the impact on phone size on women's hand and arm health, as well as physical comfort. In fact, speech recognition software is trained on recordings of male voices. Google's version is 70% more likely to understand men than women. So they're just some light-hearted kind of examples, but I think that, you know, why should we not consider that these types of bias play out in much more important aspects of our lives? Health, work, politics, political decision-making. The gender data gap is everywhere, and we need to break this bias. If we think of heart attacks, now early diagnosis of a heart attack, we all know, is essential for treatment and survival. Now, research by the British Heart Foundation has shown that women are having a heart attack are up to 50% more likely than men to receive the wrong initial diagnosis. Women are also less likely to get a pre-hospital ECG. And we know that someone who has had an incorrect initial diagnosis of a heart attack has a 70% higher risk of death after 30 days compared to someone who receives the correct diagnosis straight away. So, I mean, this is serious. These are serious things. And it's because of the way we've been informed. I use the word we, I mean everyone, healthcare workers too, as to what the signs and symptoms are of a heart attack. And that's because we're basing our knowledge solely on the male experience and what male symptoms are. And in fact, over a 10-year period, the British Heart Foundation tell us more than 8,200 women have died needlessly following a heart attack. And they could have been saved if they'd received the same quality care as men. So we need to break this bias. Another example is Alzheimer's. In the UK, Alzheimer's disease is almost twice as common in women compared to men. Well, why is this? Well, for a long time, clinicians and researchers have put it down to the fact that women live longer than men and didn't really explore it any further. But just more recently, researchers have begun looking at this in more detail and looking past this assumption. And early discoveries indicate that the impact of biological underpinnings may contribute to the underlying brain changes. So not just a simple, women are the same as men, they just live longer. If we talk about women in research, there's always been an underrepresentation of women in clinical trials, and it stems from long-held assumptions that the male perspective represents the norm. Differences, though, in pharmacokinetics of drugs between the sexes can be related to body composition and size. Women typically have a lower body weight than men, so when taking the same dose of drug, it results in a higher level of that drug in a woman. And that's why we see an increase in adverse drug reactions in women. In fact, the data suggests women experience adverse drug reactions nearly twice as often as men. However, women have been included from pharmaceutical research for many reasons. Now, we can't ignore the thalidomide tragedy of the 1960s, which prompted a kind of protectionary ban on pregnant women and women of childbearing age from participating in clinical trials. But there have been other obstructions, and that is they have perceived complexity and higher costs of studies if women are included. Women are often viewed as confounding and more expensive to research because of their fluctuating hormone levels. Well, I think all I can say is we'd be extinct without our fluctuating hormonal levels. So, you know, we need them. In 2014, I know that's some time back and I wasn't able to find some recent data to share with you, but less than 2.5% of publicly funded research was dedicated solely to reproductive health, despite the fact that 1 in 3 women in the UK will suffer from a reproductive or gynecological health problem. For example, endometriosis affects 1 in 10 women, which means it's as common as diabetes in women. Yet the proportion of funding that goes to diabetes far exceeds the levels of funding that goes to endometriosis. And of course, endometriosis is a disease just affecting women. One bit of data I found is there's 5 times more research into erectile dysfunction, which affects 19% of men, than into premenstrual syndrome, which affects 90% of women. I'll leave that one there, but let's break this bias. When we think about pregnant women in COVID research trials, well, the disparity in trial inclusion has been completely exacerbated by the COVID-19 pandemic. And in fact, pregnant women were initially not allowed and included in COVID-19 vaccine trials. A recent report of 927 trials reported that just, and these were about COVID, 52% of the trials explicitly excluded pregnant women, 46% did not mention about pregnancy, and only 1.7 specifically included pregnancy. And this exclusion evidently impacted on the very slow uptake of vaccines, COVID vaccines in pregnant women. And just last December, the Royal College of Midwives and the Royal College of Obstetricians and Gynecologists emphasised the urgency for pregnant women to receive the vaccine. And that's because at the time, 20% of the most critically ill of all ICU patients with COVID-19 were pregnant women that hadn't had the vaccine. So this is the consequence of this bias, and we must break it. So the default position should be to investigate and treat pregnant and breastfeeding women in the same way as we treat and include non-pregnant women, which, by the way, should be the same way as we include men, unless there are very clear reasons not to. I think if time allowed, but I think we should come back to this another time, that we really need to acknowledge the appalling underrepresentation of minority ethnic groups in research, as well as women from deprived areas and lower socioeconomic groups. A lot more can be said about these issues, and I think we should return to it another time, because we really do need to break this bias. With us having Margaret here today, I just thought I'll end on, if we're going to achieve any kind of equality, I think then it's essential that we have equal participation and leadership of women in political and public life. However, the data shows that women are unrepresented at all levels of decision making worldwide, and achieving equality in political life is far way off. If our government, in our own government here in the UK, 35% of MPs in the House of Commons are currently women, and this is an all-time high. In the House of Lords, it's 28%, and around just 36% of local authority councillors in England are women. So I think if we're going to get anywhere, then we really need to break this type of bias. Thanks very much, everyone.
Thanks very much for that, Rebecca. Excellent talk. Very interesting. Right, there's so many important issues raised there, wasn't there? We could literally talk about this all night easily, but we've only got a minute or two. If anybody's got any questions or other points that they want to raise, and I think you're right, Rebecca. There's other issues that we could do with coming back to it with another meeting, without any doubt. In the near future. Teresa.
Hi, thanks for that, Rebecca. Fabulous as always. I just wanted to mention something that I've spoken about on many occasions at our MPA meetings and outside, because it's so important. And it's about the attack on women's bodies and the male domination of women's bodies, women's contraception, birth control, etc. Takes two people to make a baby, but the onus is left to the woman. And I'd like to see young men and boys and older men being given the implant in their arm for 5 years, like women do, unless they want to have babies, and then that implant can always be removed, because I don't think the onus should be on the woman. And also, when women have had as many babies as they think they might want, the male partner will suggest they get their tubes tied, they won't go and get the snip, which is another attack and abuse on women's bodies. And something I've spoken about at length is about the mesh debacle, the fallopian tube debacle, and the breast debacle. And the breast one was that surgeon who operated on about 2,000 women and one man, and he cut breast tissue away when women didn't have cancer. He created a cleavage in his likeness of what a cleavage should look like. And this disgusting man had 2 daughters, by the way. And it had been flagged up, but no action was taken really, and nobody was there to oversee. And I think the arrogance at the top of the profession in medicine is that people arrive at the top and they don't think they should be overseen by anyone. And I always think you should have gatekeepers, because if that had been the case, he may have done 10, 20, 30 operations and then being found out. But as it was, all these women's lives were destroyed. The mesh debacle was for bladder incontinence, sometimes for prolapse, etc. And it was stated after the trials on this mesh, it should only be used as a last resort. It was used as a first resort, and the mesh got embedded in the flesh. Women had major pain. They couldn't go to work. They couldn't look after their children properly. They were taking medication all the time. And the fallopian tube debacle, it's like coils, but instead of it being a contraceptive coil, these coils were put into both fallopian tubes, and they were made of nickel and plastic. And nickel causes a lot of inflammation and irritation. The fallopian coils got embedded in the flesh or migrated elsewhere. And as a result, women were in intense pain. They couldn't go to work. They couldn't look after children. They were debilitated in many ways. And I think it's important to talk about that assault on women's bodies, because it's men who produce these gadgets to put in women, on top of women, beside women, under women. But these, show me a gadget that's been put into men recently. I can't name you one. And so if we don't talk about this, nothing will change. And I remember when I spoke about this in the room one time, a man got up after me and said, bloody hell, I feel like I'm at a Me Too meeting. And I was absolutely gobsmacked, because you showed me where you are on Me Too for a start. I didn't even respond to him. He revealed himself. If it's a problem for you because I'm talking about the attack on women's bodies, maybe you need to interrogate that. So I'm sure more gadgets are being made as we speak to shove somewhere in a woman. And I'm actually sick and tired of being sick and tired of women's bodies being used as experiments. And what you said, Rebecca, about everything is the male model, I think even pregnancy is the male model, because how many obstetric gynecologists, who are predominantly men anyway, tell women, oh, you don't know what you're feeling, oh, it's your first pregnancy, when they're saying, I feel that something wrong. If you're carrying that child in your body, you know better than any man on this planet what that feels like. But this dismissive attitude is arrogant, condescending, and towards black and brown skinned women, even professional women have been spoken to like they're less than, they haven't got a clue what they're talking about, to the point where some black and brown women in pregnancy have been told, why are you screaming? It's not in tune with your contractions. I mean, you couldn't write it, but they're writing it and they're being allowed to get away with it. And I know that you would call that out, Rebecca, because you know your stuff and you talk about this all the time, but I'm sick of it. I'm over it. Just wanted to put that out there. Thank you. And there's lots of legal challenges now because of the fallopian tubes, the mesh, etc. Whether these women will get compensated, I don't know, but I hope they do. Thank you. Thanks,
Teresa. You want to come back with anything there, Rebecca?
But no, I mean, it's abuse, isn't it? What you're describing, Teresa, absolute and utter abuse, and it's the control that the men have. Then it's, you know, at all levels. So, and then when you have an abusive man in a controlling role, as you do in obstetrics and gynecology, where the only people that it's women that they are supposedly caring for, where then it just runs rife, doesn't it? But I think well said, Teresa.
Yeah, excellent. And if I just come in quickly, I mean, we've had all the scandals in North Staffs and up in Cumbria, haven't we? And other places over scandals in maternity. And by and large, from what I could see, it was women. It was because women, pregnant women, were ignored. You know, they knew what was wrong, and you were told, "Go away, nothing to worry about." And the child died in some cases. The mother died as well. This is in the 21st century. We're not talking about childbirth in the 19th century. You know, and it is down to that arrogance, isn't it? I don't think there's any doubt whatsoever with that at all. We've still got an awful long way to go. Leslie, okay, if you want to come in.
Yeah, thanks, Frank. Yeah, really interesting points, Rebecca. And this really is why we need to keep Liverpool Women's Hospital. The Women's Hospital, I'm not saying it's perfect, but the Women's Hospital is actually involved in quite a bit of research around women and pregnant women, and because the nature of the hospital, it's in a good position to have a sufficiently big number of women to research on. And we want to keep the focus on women, which is why we're totally opposed to any merger with the Royal or the Super 6 merger that they're now talking about as a possibility of merging 6 hospitals in Liverpool, including the women's. Why we want to keep it on its site, so that again, it's the focus is on women and all aspects of women's women's health, and some of the amazing things that are done. So for instance, we saw robotic surgery film clip at the last board meeting where women with endometriosis or horrifically large fibroids could actually be operated on safely, and instead of being in hospital for a week and on strong painkillers for several days, often they're only in for a day now with minimum painkillers, and that is tremendous. And I'll just finish on the point that both Frank's just made about, and Teresa, women are listened to, and the focal point of those scandals is, 1, women not being listened to, 2, the maternity staff and midwives either being not listened to by consultants, being overstretched, overworked, and that leads to mistakes. And it's Kent, Shrewsbury, all those other areas that Frank's mentioned, and we have come across some of us in the campaign with some pretty arrogant consultants. 1 or 2 actually moved on, but this is why we got to keep the campaign up to Save Liverpool Women's Hospital, to have a culture where women come first, the patients and the staff, where women are properly listened to and money is spent on midwives and research. So maybe Rebecca could say just a couple of words on the maternity scandals, as it were. Thanks.
Okay, Rebecca, if you want to come back with that. Thanks, Leslie.
Yeah, thanks for that, Leslie and Frank. And I think that I think that's the thing. I think we automatically then blame the midwife and think that the midwives or the obstetrician in these cases isn't a good person, and they are therefore, they're not listening, but actually it's just because they're an uncaring person. I think we have to think about the context and what's happening at the moment in all areas of healthcare. And the fact is, there aren't enough midwives to listen to women. There aren't enough clinical staff to do it. So therefore, these scandals will continue, and these scandals, I hate to say it, will get worse, and they'll get bigger, and they'll be going around because we don't have enough midwives. That's the upshot of this. This is what is happening. And if you underfund an area, like, as they did with transport, and destroy it so much, you can't safely work as a midwife. You just physically can't care for people. You can't do the right thing and people are human. And if they've got 3 maybe women to look after in labour, how can you give proper care? So when something goes wrong, the women, a woman will say, I wasn't listened to. The chances are, though, she won't have had a midwife with her all the time and things like that. But it'll be the midwife that gets blamed. But actually, it's the system that needs blaming. And I think if we keep focusing on that the midwives aren't listening, because 99% of them will be listening, but they just physically can't do it. If we're going to change anything, we need to start blaming this Tory government and blaming, what's going on with the Labour government in that. It's in we have people, thank God, like Margaret, but we have many people that don't, West Streeton and people like that are supporting this healthcare bill, and they just want it privatised, and it's going to get worse. But this is politics. This isn't about people not being nice.
Absolutely. I don't think anybody was saying that. I think it obviously is to do with cuts and all the rest of it. But and it does all stem from that, doesn't it? Without any doubt. Okay, we need to now talk about future plans, really, for our campaign in Cheshire and Merseyside. And Jenny Haley wants to talk about the organisation around the lobby of the regional Tory party conference in Blackpool on the 18th of March. So, Jenny, if you want to come in.
Yeah, sorry. We did have a meeting. There's been various things going on. Obviously, Friday the 18th, I am looking this way because I'm reading, so apologies. Friday the 18th and the 19th is when the conference is on. There is a meeting on the Thursday night, but looking at resource, we're looking at doing things on the 18th and 19th. Friday the 18th, there have been various groups that have got together, you know, from TUCs to campaigners to all sorts of union members. We're just anybody that wants to come along. Now, what we're going to do is because they've got speech, you've got keynote speeches on all day at the conference at the Winter Gardens. At 10 a.m, we're looking to gather in St John's Square, which is just next to the Winter Gardens. We're looking at stalls, posters, noise. The anti-fracking nanas are going to yellow ribbon the whole area. I know we're taking some NHS stuff. Where I'm particularly part of, this is how I know everyone here, or a lot of people here, Chorley NHS campaign. So we'll be taking things, there'll be 2 speakers there that day. Now from 1:30, we were looking to, just after lunch, actually get groups to speak. There'll be different themes concentrated in a certain time, you know, a certain time scale. I mean, the full details are to be confirmed, but you're looking at stand up to racism. They're going to also cover issues with refugees. Don't forget, there's a hotel in Blackpool where a lot of refugees were basically just dumped, and they're still dumped there. So, you know, there's going to be a lot of that covered. The NHS, we've got a slot in there, so anyone who wants to come down, we'll need speakers during that time. There'll also be a slot on the environment, and they're going to do a piece on what levelling up really means, and the fact that all these different campaigns are actually stood there in unity, helping each other to all be on the same level, and that is what levelling up means. So that is the sort of thing we're going to be doing then. That'll probably go on till about 4:30. Obviously, anyone who turns up in between these areas who are going to speak against the Tories and what they're doing in all sorts of areas, well, every area really, is going to, I mean, we're looking for the anti-war movement to come up and speak as well. So there's loads of things going on there. So that's on the Friday from 10 a.m. till probably about 5 o'clock. That'll be the day when we'll need bodies to come up there. That'll be fewer bodies. However, the main day that has been organised, well, the march that has been organised by the TUC will be being held on Saturday the 19th. Now, there are some coaches, so get in touch with your local trades council, see if there's one going from near you. Now, they're looking to assemble outside Blackpool Tower at 10 a.m. Some speeches will be made. I'm not sure if it's before or after. I haven't confirmed that yet. But we're going to march up then, everybody together to the Winter Gardens. So that's make lots of noise. So if anyone or any group, please spread this out to all your contacts. Mary, Frank, Leslie and Felicity know my details if anybody wants any more info as we're going along. I'm keeping them informed anyway. But if we can get as many people, groups, either day, both days, it would be absolutely wonderful. Let's make some noise and kick them out. Thank you.
People know this.
Okay, Irene, you got a hand up there. Thanks a lot for that, Jenny. Brilliant.
Hi, thanks,
and then
Jenny.
publicity. Yeah, okay.
I'm sorry I had to leave the meeting the other day early. But before I left, there was talk of the TUC arranging coaches. Do you know what happened to that?
The TUC are arranging coaches for the Saturday because that's when they've got their march. But we don't know the details on it. Nobody in the room knew the details. I had emailed Jay, who's organising it, Jay McKenna from the Northwest. Now he does say he's got national backing, but he's arranging it from the Northwest. So we're not quite sure on the details of the coaches, but if anyone is in touch with the local trades council, they will have access to it. Like I say, I have emailed him to say, is it only trade council people that can get on them? Because we've got lots of people outside of that area as well as union members. So how does it work? But I haven't heard back from him yet, so I will follow it up after this meeting, and I'll let you know as soon as I can. But if anyone's got local info, that'd be great.
Thanks, Jenny.
Okay, cheers. Felicity.
Two aspects. Sorry, two. Get it right eventually. There's two aspects I want to raise here. One is that at the meeting yesterday with all the different arrangements, there was a request of could we get the van, the ad van again, and take that up to Blackpool. Now, the ad van cost us £800. And if we're going to say yes, and I'd love to say yes, we've got to get people saying they'll chuck some money in, or we'll get, that we can get some donations from the union branches or the trades councils to do that. But I think it would be a lovely idea to have that ad van trailing round centre of Blackpool to annoy the MPs as they wander in, between their hotels and their booze ups and their conference. So can we? Can we basically agree we would like to, but we want to see, can we raise the cash to do it?
It was my request really, because I'd seen you all do it, so it was me just asking you really. Just happened to be in that meeting. I mean, I know our campaign will put some money up for it, so that's what I was thinking. But it was just a case of seeing where we were with how much and what we could put. But yeah, I mean, I'm okay for saying, how about we can get some from unions as well. Like I say, our campaign will probably put a good couple of hundred up. Depends how much it's going to be for the one day.
Yeah, well, we will follow that up. So long as people here are basically happy that we follow that up, we'll follow that up.
Yeah, but I wasn't thinking that you were paying for it. Just
no, if we could, we would. We just
I know
spent a hell of a lot of money. We're good at raising money, but we still need to raise some more. And the second thing is that we've now got to look at kind of pacing ourselves, getting ourselves, back into doing stalls, getting the stalls going again, getting more door-to-door leaflets, and particularly, it's been mentioned earlier on, focusing on Tory MPs. Warrington Trades Council are having a meeting tomorrow, and it's an item on their agenda. So we're hoping we can get back up to Warrington, and I will need bodies, please. When we've got a date, I'll circulate the date when we've got it, when we're going back to Warrington. But Bob, who's on the line, is doing, sterling work, but with very few people to help down in Crewe and in Winsford. There are also areas with Tory MPs, and we need to keep the pressure on in those areas. And a final sort of organising point is at the anti-war demonstration the other day, or meeting in the street the other day, I was talking to some youngsters who just graduated from Liverpool Uni, and they were talking about where it would be best to leaflet the Liverpool University students. So we've got some ideas as to how to do that. And again, we'll share them round with dates, but anyone's got any other ideas, then let's see what we can do about that. So it's we're still on a war footing, folks, even not quite as mad as we were the week before last week. We still are working hard on this, and we want to keep it going. Okay, sorry, that's the end from me. Thank you.
Thanks, Felicity. If I can just come back from a couple of things that Felicity said. Yeah, I mean, I'm sure those of us in the Wirral can get down to help you out, Bob, down in Cheshire. and it is something we talked about a little while ago, and it's important. I mean, there are several Tory constituencies there, aren't there, which you can get involved with, and Warrington as well is another important one we need to be thinking about as well, and there are others, aren't there? But that's something we need to be doing. And I think the stall thing is important in centres of, decent footfall on a regular basis if it can be done. We've been doing it in West Kirby on the Wirral since early summer, mostly West Kirby every Saturday more or less, and it's been very successful because people expect you to be there and they come and ask for the latest leaflet and this sort of thing. So that's quite good, and I know it's been going on in other parts of the world as well, but we've been particularly at it every Saturday in West Kirby, and the reason why we picked West Kirby is because it's got a decent footfall, because you get people from all over the place coming, so it's picking a place like that is quite useful, I think. Richard.
Sorry about that, just need a little bit of privacy. Well, I've just heard that Lords and MPs will be voting on the bill in days, and I'm really worried that we could lose our NHS sooner than we think. How can we get more people to wake up and have us come out in numbers not seen since the 2019 People's Vote protests?
Okay, Richard. Yeah. Was that on the news? Was it? You saw that, presumably. Yeah.
I think it was every doctor or just treatments. I just saw a tweet saying that they were playing their digital adverts around London today.
Right. Okay. Yeah. Okay. Does anybody want to come back with that, or come back with anything else? I mean, yeah, Felicity, have you still got your hand up, or is that
No,
legacy hand? Okay. I mean, I think in terms, I mean, in terms of getting the message out, it is a matter of being out there on the streets, I think, as much as possible, as well as using social media. And as Felicity said, we've got rid of 10,000 leaflets just recently, and they were given out, on the streets, different demos, and door to door as well. I think that's right, Felicity. We did deliver some quite a few door to door. I know we did on the Wirral, and that's what we've got to do. We just got to keep getting out there and keep getting the message out and speaking to people, because we're not going to get it in the media, are we? There's no chance. Having said that, there's the odd time you can get stuff in the media locally with phone-ins and things like that. It is possible, but by and large, we aren't going to get anything into the national press. So it is a matter of doing what we've been doing, really. And I think the door-to-door leafleting is very good if we can do that. I mean, what we've done on the Wirral is used the Labour Party networks, Labour Party members. I mean, whereas the Labour group and the Labour Council have been absolutely awful and have just done all they can to cooperate with the bill going through. The members have been really good, and they've been getting out there and doing stuff and so on. So that's an avenue that we can use, I think, to help get our message out there, really. Have you still got your hand up, Richard, or is that from before?
It was from before, but I would like to add that we really need to win this fight soon. I just hope we actually do. I'm sick of all these protests that don't work, whether it's Brexit, the Iraq War, or whatever else.
Okay, Richard, yeah, fair point, I think, without any doubt. We did say at the outset of this campaign that we wanted to build a mass movement similar to the poll tax, and we did win the poll tax, didn't we? and somehow we've got to get back to that. I was trying to think back to those days, and trying to think back how we did it, and particularly how we got the publicity going, and I can't remember really how we physically did it in that sense. I remember the demos and all the rest of it, but I don't remember any of that. I mean, I think one thing with the poll tax was that we were able to go on strike and not pay the tax, and that really hit home, didn't it? And it's trying to do something equivalent to that, which would be really useful, I think. I also think we've got to be thinking in terms, me personally think we've got to be thinking in terms of sit-ins and this sort of thing, which is another thing as well. I think we need to be thinking of, even if it's just token things to raise publicity, even if it's locally. I think that's important. Okay, Teresa.
Yeah, I suggested things like flash mobs. You can go to supermarkets, leaflet as many people as you want before they throw you off the land, which they often do, and tell you it's private land. Just show up, leaflet and go. And you can do that anywhere, on any street, at train stations, everywhere, and just show up. That's all you need to do. Whenever I leaflet, I tell people to take a picture of both sides of the leaflet and put it on WhatsApp, Twitter, social media, anything, just bang it out there, because you reach more people that way. If people say, can I take some leaflets, ask them to leaflet their road, because that means that 3 people don't have to go and leaflet 100 roads if people take and do their own street. It's all the things that you need to do. Another thing I do, I always leaflet the buses. And if I've got time, I'll shove our leaflets in the metro. It's not a paper I read, but if people see that falling out of the metro, they might think the metro people have put it in there. Stick them on top of all the newspapers. And I do find that the bus drivers are very good and they don't throw our leaflets away. So it's just wherever you can, wherever you're going, leave leaflets. I spoke to 2 people today in the post office in the city centre. The woman was on crutches because she needs 2 knee replacements. The guy has had 2 hip replacements. He knows her, but he's not her partner. And I could hear him telling her how great it was in Spire. And you get a menu to pick your food off, blah, blah, blah. So I got my leaflets out my bag. And I said, excuse me, I wasn't listening in, but I heard NHS and my ears prick up. And I said, the NHS is going if you don't fight for it. So you looking at the menu is going to be the last of your worries, because you'll be paying £18,000 for 2 hip replacements. He didn't seem to think it was serious. Anyway, I shoved the leaflets at him because he didn't want to take them. He told me to give them to the woman. She was very receptive, and she was explaining what's happened, that she's had scans, she's seen specialists and everything. And she said all the money they've wasted on that, they could have just done my knee replacements. And she's going on Thursday. So I said to her, when you go, just tell them you can't do anything. You need people to look after you, which is false economy, because if you have your knees done, you can look after yourself. You don't want to depend on your family. You're in chronic pain, which she is. I said, just let them know that you can't live your life and just go at them. But she was fabulous. And she said, I'm going to put this on social media. He ambled off because he'd had his bloody menu at Spire. She totally got what I was saying. So yeah, you've got to have the conversations with the people. And what I do now, I tell them, I'm not saving the NHS for me. I'm not a sick person. It's for disabled people. It's for the man who I met on Bow Street, who's got 3 disabled children in wheelchairs. His kids will die. And I don't care. That's what I just tell them straight. And I don't shut up on the bus until I'm getting off the bus. And when I finish talking, because I talk to the bus, I no longer talk to one person. And you get people who say, oh, I've got private healthcare. And I go, and all you Booparians, whatever you're paying now when the NHS is gone, times it by 1,000. My name's Teresa. You heard it here first. Bye. Have a good day. And I'm off the bus. You've got to keep it raw and let them know it's going. And disabled people will die. So, yeah. Just talk at them. I don't have anyone who gets nasty anyway. I did have one guy tell me he was a socialist. He was a Veuve Clicquot, for anyone who knows champagne. Veuve Clicquot is what the rugby players drink. It's very expensive. And he said, oh, I've got private healthcare through my employer. He said, but I don't want it. I said, when you go to work on Monday, tell him you don't want it, you're going NHS. So yeah, just talk at the people. We haven't got time to be flowery about it. Just let them know people will die. I always say kids are going to die, disabled kids are going to die, babies are going to die. That does get people's attention. So yeah, just talk at them.
Thanks, Teresa. Yeah, couldn't agree more. Excellent. You couldn't come over here for a, for a little bit, could you? Just, sort of, it's not right that Liverpool have you all the time. You could do it crossing the Mersey. Right. If there's nothing else, we'll close. I think. Is there any other last minute things that people want to say? Okay. Been a good meeting, I think. We need to do what we need to do.
Let's win this. Let's save the NHS, whatever it takes.
And we do need to win it. And you're right, Richard, whatever it takes, because once it's gone, it's gone. And to echo what you said, Teresa, I really like that quotation, which we've used as a leaflet and a banner from an activist in the States who said, take it from an American. If you lose this, you'll die. You won't die right away. You'll sell your property first. Yeah. But that's what will happen. And that is straight from the horse's mouth. And it's absolutely true, because that's what happens in the States, doesn't it? Okay, we'll leave it for this evening then, comrades. See you soon. Thanks for coming. Okay.
Bye, everybody.
Bye. Thanks, everybody. Bye. See you. Good night.